and to tell us all the things we got wrong in the first part of the day. And we allocated an hour for it because we thought it probably would take a long time for them to list these things. No, not really. So they're charged with giving their perspectives on some of the questions that we came up with and discussing, leading a discussion on those topics. So. So the two people here, I actually have known them both for quite a few years. Bob Rosner has been at the University of Chicago even longer than me. He once was my lab director at Argonne National Lab, where I also work, but he's really an astronomer and astrophysicist with a very long history of learning amazing things about supernova and many other topics via large-scale numerical simulation. And more recently being director of the Energy Policy Institute at Chicago, which has led you to know something about policy. I guess you've known about policy for a long time, but that was a very focused effort there. And then Mike Franklin, I knew when he was a computer scientist at Berkeley, but he's recently, as some of you, maybe many of you know, we are very fortunate to have him join us as the chair of computer science and the senior advisor on computation and data science to the provost, I guess, right? Yes. Yeah. And maybe the vice president for research as well. Seeing as anyone who listen, yeah. So he came to us from Berkeley, as I said, where he did a lot of things, but one was lead the so-called AMP Lab, an initiative to investigate opportunities at the convergence of algorithms, machines and people, so big computing, big data, and I guess crowdsourcing as well. So which led to a lot of really interesting results, such as the Spark system as featured on his laptop. I think, yeah. Okay. Anyway, thanks to both of you for being here with us.
We strongly welcome a conversation. I think what this really should be more in the nature of a conversation rather than us telling you what you said. I think you know what you said. Maybe, Mike, you can start off with some of the things that, your comments about big data.
Sure. So yeah, as people were presenting and commenting on the presentations today, Bob and I were tasked to try to figure out what some of the underlying themes were, and we can see how well we ended up doing that. But I guess the first theme I wanted to call out, which I've heard sometimes said explicitly, sometimes it was just implicit in what people were talking about, was this idea that big data isn't a panacea, right? So it's not just that all of a sudden you turn on the spigot of collecting data because now it's much easier to do than it used to be, and then all of a sudden, valuable insights pop out that are going to change the way medicine and healthcare get done. And so I thought it would be worthwhile having a short discussion on maybe, what is it? Can we list the some of the main causes that block progress from once we've been able to collect the data to actually being able to come up with actionable insights that improve outcomes. I think Bob had an interesting, what was your term, disease? You had an interesting term for the problem you were trying to solve. In disease, I wrote it down somewhere.
Disease burden.
Disease burden.
Yeah, that's just that's a metric that people.
Yeah. So, but just in general, what are the roadblocks? What are the things that are keeping us from making progress? And then what are the right metrics to see if we're making progress? So, I wrote down a few, and maybe I'll start. So one thing that came out a bunch of times was the fact that sometimes you're just not able to get to the data that you need, to the right data or whatever. And so there are a few reasons for that. One that Bob brought up a number of times was this idea of interoperability, that data gets collected in various places by various systems, by various people, and sometimes it's just physically difficult to get the data into the same place. Ian spoke about that. Sometimes, even if you can get the data in the same place, a more difficult problem is that the data just doesn't match up, and it just isn't semantically integrated in a way that you can use the multiple data from multiple sources. So interoperability is a big roadblock. Security and privacy concerns obviously are something that keep us from getting to the data that we need. And then a third thing that was brought up, which I would hope would be solvable, was just a lack of knowledge about what data is available. So in particular, at our university, we heard today about people that have access to various interesting data sets. Some of that they're allowed to share, some of that they're not. But there seems to be a need for a mechanism for us to be able to learn about and discover the data resources that we already have access to. So, so just in terms of lack of access, I had interoperability, security and privacy issues, and just the inability to know, lack of knowledge about what we already have. Does anyone have anything to add or suggest along those lines?
Well, lack of access encompasses people that don't want to give you their data just because.
It's theirs.
Yeah. Yep.
So maybe I can add a slightly more general comment. So so I've one of the things that I've been busy doing is also spending time over at the Harris School of Public Policy. And Harris has been interested also in getting into this area of big data science. And what I've discovered is that among the social scientists there, so I'm the only physical scientist over there. And there is an amazing culture, I was going to say gap, it's actually a chasm, between the way certainly physical scientists tend to think about data science, and the way they think about data science. So let me be quite specific. I'd be very interested to know where you guys fall. Okay, so when you look at large data sets, you can think of two approaches to them. One is to be able to ask questions that could only be answered by having a very, very large data set. And a number of you talked about such things. I mean, Bob, for example, Bob Grossman talked about examples of those. And so did Android. So, and that, that makes perfect sense. Another kind of way of approaching big data is to do fishing expeditions. So fishing expeditions is you don't have a particular question in mind. You just given a large data set, and what you hope is by looking at it in different ways, you're going to discover something. Not rediscover, but discover. And I would say that among physicists that tends to be derided to do that. But there's some interesting examples of where it's actually very fruitful. And I think we heard actually at least one example of that today. Sometimes what you like to do is you like to see whether or not there's something in the data that's anomalous. So you have to think deeply about what you mean by anomalous. So in astronomy, the data set that Ian talked about, the Digital Sky Survey, is an example of how this was done. So, so what you have is you have hundreds of millions of stars. So these are basically just points of light in the sky. And the question is, how do you know that there's something odd up there? So odd means something that's in the tail of distributions, way in the tail. And so here's how you might do this. you create a probability distribution function for the things that you see. And then you ask what fraction of the objects you've actually seen actually fit into that distribution or are outliers. And this turned out to be, for astronomers, hugely consequential. I think all of you probably do care about how old the universe is, I hope. Or maybe not. We do.
Maybe not on a daily basis.
Not on we don't think about it, right. But just a general theological question, how long has the universe been around? So the yardstick for that are certain kinds of explosions called type 1a supernovae. And they were thought to be standard candles, meaning that every single one of those stars, when they explode, is exactly the same brightness. So you can tell where they are, how far away they are. So the question is it true that all supernovae of this kind are in fact standard candles? And that question was answered. The answer is no. So maybe there is an error in how old the universe is. An example. One interesting question would be for you, whether this is an interesting topic. When you look at, for example, the data set that you have for outcomes, can you find anomalous events? Or can you find things that are outliers that you wouldn't have expected to happen? Is that something that people in this field actually look for? Yeah, that's the whole point. Otherwise, it's not going to be a conversation, right?
Right. I think both of you point to an issue that really motivated this Chaz group to move forward in this direction, and that is that we not only at the university don't really know where the data sets are that are relevant to us. It's very hard to know what questions people are working on. And so our idea about building capacity within the institution really requires not only this idea of a website with all of the data access is a great idea, but also it's, I think, a more intense intellectual process to get researchers together to say these are the questions that we're working on. And you know, your ideas about how that might happen, I think it happens among collaborators. I think the CI has done a great job of putting people together who have shared interests, and maybe that's the way to go, but I'm interested in your ideas about that.
Well, so it's an interesting problem and a hard problem, you know, not just in medical data, but actually in all data analysis areas. Even to the point when I visited Facebook, it was probably now a couple of years ago, and they, you know, obviously collect masses of information every day, but that information is dwarfed by the amount of computed data that they actually generate, because people run analyses on the raw data, and those analyses generate huge data sets, and those data sets fill up, you know, their infrastructure, and, you know, there's a lot of concern there, just that people are doing the same analyses over and over again and not even knowing about it. So just, it's not unique to this field. But, you know, both Bob and Sam, you know, talking about the infrastructures, what was it? Oh, I'm sorry, it might not have been Sam. It was, it might have been the Julia, it might have been your thing, but, you know, we heard at least two cases where in the process of trying to provide a data service, there's this additional service that can be provided where you have some metadata repository of, you know, here's a data set that was generated, you know, for this purpose by this group. And then, you know, you could maybe go so far as to do the Amazon trick of saying, you know, here are some data sets you might find interesting. But it's yeah, there's not an easy solution for it. And while I think getting people together to talk about what they're working on is probably, you know, the first step you'd want to take, There are technical problems you'd have to solve to think about how to describe, how do you define the right set of metadata so that people can search and find to see if data that they need or analysis that they need have already been done. Yeah.
I was thinking of that sort of dichotomy between the fishing expedition and a more tight analysis that's based on prior hypotheses. And I wonder if there's something that's a little bit in between, that's sort of like the guided fishing expedition, where you're on a fishing expedition, but there's a high level of knowledge of the context. And an example, a team that at the New York Crime Lab that I was not involved in has been looking at trying to understand high-risk reoffenders who commit domestic violence. And they had a big machine learning, big data project looking in New York City at all the calls. And they found that calls that involved an ambulance coming, even that independent of the charge that was filed in an initial case, if an ambulance had come, that was a very strong predictor of a serious act of subsequent violence. And when this jumped out of the machine learning algorithms, they could talk to people who were involved in law enforcement in this area, and they said, yeah, there's a lot of cases where you're never going to prove what happened, or the person doesn't press charges, but she had a serious enough injury, so there had to be an ambulance. And it made a lot of sense, but people hadn't found it until they went on the fishing expedition. And it does seem to me that you want to be open to some of that that comes out of the big data, as long as it's tied back in a disciplined way to, this is why we think this actually makes sense.
Right. So I agree with you. Actually, I think the distinction, this distinction that I made, is actually too categorical. And in fact, when you do fishing, basically what you're in the business of is an iterative process where as you fish for things, you basically build a filter. You're building continually refining your filter to look for things. And as you build the filter, you're actually starting to ask a specific question. You're starting to build a hypothesis and looking for specific things. So I think the distinction is not as categorical as I made it out to be. I just did it for argument's purpose. I should have said one other thing, which is highly relevant here. So one of the questions I asked the Harris faculty was, so do you think that the era of big data is going to fundamentally transform your field? And what I meant by that question, to see, push it a little bit further, is it likely that the business that you're in is going to be fundamentally from the point of view of fundamental methodology, is it going to be transformed by big data or not? And there were two camps. They had drastically different answers. And one camp was focused on the question of delivery of services and whether or not, so they were particularly interested in administrative data, for example, and they thought that that big data was going to be hugely useful in improving services. In particular, the join of administrative data to other kinds of data was going to be hugely useful for them. I would say that the more theory-oriented people at Harris, the political economists, were hugely skeptical and thought that, yes, they agreed that services would be improved, but from their point of view, no. So so there is this interesting question about, I think in this audience, certainly what I heard most of the day is, I didn't hear any dissension from the idea that you're going to be able to, in particular, improve services. There's no question about that. But you should know, in the social sciences, there is an issue.
So just taking on this question that Howard asked in response to it, one of the really interesting things about this clinical data is that it keeps coming. And so no matter how much of a fishing expedition you go on and how overtrained of a model that you create, you always pretty rapidly can get access to additional data or another data from a similar source that has a similar kind of data. And so my sense has been, while the fishing is really tough to get grants and publications for, it's really highly justified in this arena because getting more of the similar kind of data flowing that your algorithm has never seen, is that kind of validation is your ultimate answer, and it's readily available. You know, I imagine the universe may be an N of 1, and you may have a little more of a problem with that, but I'm not sure. Maybe it's maybe that it isn't an N of 1, and that's a whole nother thing.
I couldn't resist, sorry. This whole fishing expedition is a huge philosophical issue. I don't want to plunge there. But basically the difference is between testing one hypothesis, coming from somewhere, and say million or billion. If you look at today's whole genome association studies, it's basically you have a million a priori hypotheses. You test all of them, you choose those that pass Bonferroni correction, and then some. So, and yeah, you can write grants with this, actually, apparently.
Right, but
That's
I
an
think,
important point.
well, one thing I'd just like to add about that, though, is once you've gone through the effort of collecting the data, that data has value, you know, beyond maybe the purposes you initially collected it for. And so that's why both of these modes of investigation are valid. The part of the trick is to figure out when you're trying to test a hypothesis on a data set for which that data set wasn't initially collected, yes, is that valid or not? And that's where a lot of people get into trouble. But it depends on the data, yeah. Right. Yep.
Right. However you want to allow that.
Right.
So we have a de-identified data mark now that we think that's sort of read only, but we're going to try to do the trace, but we have to try to work on making this available.
So I just, I don't mean to shift gears too much, but I want to go back to actually Gene's questions a bit about sort of oversight governance. How do we know what everyone is doing, even within the university? Just sort of a boring bureaucratic question. I have like two examples of what I think, one's example of non-functioning, and then one's an example of functioning. So the brief time that I did work at Health and Human Services, a repeated activity in government, and I think Bob will attest to this, is actually just reviewing what policies exist. So I'm not going to say what part of the partisan span I'm on, but it is true that government is enormous. And one data set that's enormous and growing is government regulation. So we have actually people from city, state,
Right,
federal. Nobody reads the Federal Register. The number of rules and regulations that exist is enormous. And government doesn't even know itself what rules and regulations exist. So a regular thing that bureaucrats do is, what are actually the rules and regulations for a given policy? And they're unaware of what parts of government are doing what because it's so large. And so actually this microcosm of people, investigators here, we're not even that big, but we don't actually know what everyone's doing. We don't know what data sets exist. And it might require, and the problem is it's constantly growing and evolving, so no one knows what's going on, but it requires sort of this boring kind of regular return and evaluation. A highly functioning part of healthcare research where actually the universe of data is known, and actually a good system has been created through actually some forcing mechanisms, is actually clinicaltrials.gov. I think that's actually been an enormous success. All clinical trials are now forced to are actually registered as they begin. The hypotheses, the aims of the studies are all laid out in advance. What data is going to be collected, and the forcing function has been actually the publishers of journals. So you can't publish in any of the major journals your clinical trial unless you've registered through clinicaltrials.gov. So that's an example of where all data within a given type of study in biological sciences and health, everything's supposed to be registered. And so I don't know where we want to be on those extremes in terms of just knowing what everyone's doing and what data sets exist. And just one last comment, we had actually two representatives, like we brought in one from Chicago Department of Public Health and one from Illinois Department of Public Health. We have connections to all these government agencies. They have data no one's touching. Harris students, SSA students, public health science students. There's more data.
Amazing.
And I mean, the whole theme of this is that there's more data than we know what to do with, but some of this data could be connected with the data warehouse the university's creating. Anyways.
So let me just make a comment that maybe is directed a lot to Gene. There are really two communities at this university that have related interests but very different interests. So there's the data science community that you're part of, and then there's the modeling community that you have less contact with. So the modeling community at the university actually has a regular venue where they get together every week on Wednesday. There's a seminar series that meets in Kirsten. And basically what it means is that across the university, not just in the physical sciences, but also in biological sciences and in the social sciences, people get together. There's the computational seminar series. And it's been enormously successful, and we get people, and that's something that I've been doing for a number of years. And it was started by a physicist who had very broad interests, and it's continued despite his absence. So I would think that this would be a good thing to do in the data sciences area. I think it'd be great.
So it's interesting because that, I might have assumed that data science would include modeling. But at this university,
It's
you
not.
say no?
It's somewhat different. It is different, right? I think.
Not sure what you mean by modeling.
I mean simulation.
Simulation.
Okay.
That's
okay,
what I mean.
All right.
I mean,
Okay.
you have equations and you solve the equations. That's what I mean. That was a good point.
Yeah.
So back to this issue of phishing versus hypothesis-driven research for a second. No, I think it's a hard question to answer, or it's a hard choice to make without knowing the goal of the research, right? And I think as attached as I am to hypothesis-driven research that has theory behind it and has a causal model to test it, I think that's really appropriate for questions, for example, of health policy where you want to be able to change the policy to improve something, right? And so you need to know that that effect is real, that it's relevant, that you're testing the right thing, and that if you change something, you're going to get a different result. But I think a lot of what we've been talking about today is issues where prediction is just fine. Prediction without an underlying cause, right? So if you can do a fishing expedition and find out which genetic markers are associated with a particular disease, you don't necessarily care about the causal change, right? It's a signal, and it can change practice. And so I think the answer to that question just really lies in the goal of doing the research.
At least I've noticed, over time, some of the nature of some of these conversations have changed, at least that I've observed. There's a group, there's a lot of discussions we've had today on phishing versus hypothesis-driven understanding. I think one of the things that at least I've seen in some of the interactions I've been in, as the availability of data sets grows, and as the ability to find out where that data is and bring it in and to integrate it, and sort of some of the, knowing where the data is, having metadata registries, index things. A lot of times I hear people talking about, these are people who know about Bonnefieri corrections and know how to deal with multiple hypotheses, but the issue is how quickly can they get what you might call orthogonal data that's not related to what you're doing, but if you bring it in, can inform what you're trying to understand, either from a hypothesis-driven or from a, I'm not going to use the word phishing, but let's say when you have multiple hypotheses you're looking at. And so I think what's changed here with data science at scale is the ability to rapidly bring in data. You know, it used to be that people protect data because it was so hard to get and it was their only competitive advantage. And that if they couldn't protect their data, you know, their career was at risk. Now it's, you know, if you have the skills to rapidly bring in, to locate the data, to bring it in, we're trying to, you know, we read these papers on the particulate matter's impact on healthy births. So, you know, if you look at the literature, we tried to validate this, and it was quite hard. And so a lot of this came into how can we bring in other data at scale, and how can we sort of analyze this. So I'm sort of hoping over the next few years this conversation will mature. So it's really the question, how can I meaningfully bring in orthogonal data to sort of do whatever I'm doing on either side of that spectrum? And then within the university, the services we can give to make that easier, and then the services we can support so that where there are national ways to get it, because increasingly, you know, there are national and international resources to do this. So I'm just, hopefully the next time we have this, sort of the type of conversation will change a bit, and it'll be a race to do that, because I think those people have a lot of advantages. So I'll get off my soapbox.
And I'll get on mine. So I wanted to kind of talk about two less sexier things than phishing expedition and hypothesis-driven research that are also very valuable.
Can I just say before we get off of that topic, I think we should call it fishing expedition and spear fishing. But they're both. But go ahead.
So we ran a study to understand why different genotyping algorithms are giving different results, and something that Bob alluded to. And we spent a year working with Nancy Cox and her team to create this consensus collar, and we let it loose on an autism data set. And we figured out consistently 2 of 134 samples were falling way out of spectrum. And didn't realize whether these individuals are really unique and then turned out there was a sequencing error, and that machine was constantly producing bad data on one lane of that sequencing machine. So one of the less sexier things that I want to talk about is quality control of data that we already have, which is, it's just, we need to sort of periodically do this data refresh to assert the quality of data that we have, and that's a large-scale big data analysis we need to do to at least keep it current, keep it fresh, keep it useful, keep it relevant. Otherwise, it stinks. Data gets accumulated, nobody touches it for a while, and then it disappears, or it just becomes a sort of a logistical thing. Well, we just added a new storage rack to our data center because we ran out of space. Did anybody touch the data that was on the rack nobody touched it. So why are we pushing it to? So there's sort of things that we need to do to the data, otherwise it just accumulates and it doesn't really contribute to anything. The other less sexier thing that I want to talk about, which is also relevant to folks here, was if you are, to some extent, there's also a sort of a cultural issue that people have, all right? I mean, like if you have, so let me just take one example. Like, a lot of patients who are enrolled who have cancer don't really know whether whether there's been a new clinical trial or a new drug that's in the market that they're eligible for, because nobody recomputes on EMR data, at least in majority of healthcare centers. So there's just a lack of sort of reanalysis or to see at data or patients that we're seeing to understand whether this variation that this patient exhibited is now actually there's a drug for it, or so it's just not it's just less sexier than publishing in New England Journal or not, but it's also very important that if you find even one patient that has some form of cancer that has a known drug now than the 5 years ago when they were diagnosed. I think those are the two quality control and keeping data fresh with the latest and greatest, and then recomputing on what we already have. Those are kind of related, but I think they're also very important.
I think I have one here. It's alive again. About fishing versus knowledge.
Yeah.
So consider the story of Viagra. Viagra was not intended for men's use as it is. Right? It was intended for something else, except that incidentally people noticed that it had that other effect. Now, is that a fishing expedition? Well, it is, in that it's an entirely unexpected, incidentally noticed, if maybe easy to notice, accompanying, related association. So, I think that to think about fishing expeditions as testing of many hypotheses at once isn't the right thing. I think we should think about the whole thing as a continuum in which we are doing some hypothesis testing and maybe preliminary observations, right? Think about how a child learns. Now, does a child learn by testing hypotheses? Yes, after making preliminary observations, right? And now think about how we learn. You know, the first time you go to Florence, if you haven't been in Florence and haven't read on it yet, is you see all sorts of new things you haven't seen before, right? And maybe you generate hypotheses about them and test them with other experiments and observations. It's just that the notion of that we're trying to separate the observation phase of learning from the testing reality phase of learning. It's just, they're inseparable. You can't test on what you haven't observed. I suppose if you're a mathematician, you can. But
I just want to second that. In conferences like this I've been to in the past, there's a standard slide, and I had it in my deck and I didn't show it. It's sometimes called the hybrid model, which is what Julian just said, which is there's a bottom-up hypothesis testing and top-down data science. And I think one of the things I'm surprised we didn't see, and I should have shown that slide, is just what Julian said. It's a standard thing you see, and the question is, how do you structure that so you can most efficiently do both those? How do you reduce the friction using things like Ian has and others, where you have safe computing, so that you can flexibly go back and forth as needed by a particular thing? And so that those are standard sets of slides in meetings like this. So, you know, I just want to second what Julian said, that approach.
So yeah, so I think we can start to all agree that it's a spectrum, and there's top, down, and bottom, and this is where these conversations always end up. So we will start to move on. But there is an important aspect of this which actually hasn't come out too much today, and I just want to make sure we get it out there, which is, you know, all these advances in things like cloud computing and open source analytics frameworks like the Spark system that we developed and the global genomic system that Ian's been doing. These things do change the cost equation in terms of how much you can afford to try new things and to explore for data for things that you're not actually 100% sure what you're looking for. And so, you know, with an abundance of computation resources and the tools to exploit them, you can really begin to think differently about how you design experiments, the types of questions you're asking. And that's not to say that you don't, you know, have a hypothesis or that you're not doing, purpose-driven research. But it's just that there is a fundamental shift in the cost of doing a lot of data-driven research. And it's worth us as a group thinking about, how is that going to change the way we do business going forward as these resources become more and more available. So. Yeah.
I just want to follow up on that. So, it has been a great meeting with all different people from different disciplines coming in. So from the institutional point of view, what would be the logical next step for this group to have a way to convene for shared governance, for shared experience, talents, work across division?
So maybe I can make some comments about that. So one thing that comes up regularly in ours today, and always comes up when you ask questions like that, is who's got the money? Because I've been part of many kind of workshops like this, where often you come to the end of the day and you ask exactly the question that you asked, Kylie. And there is no good answer that the group has. You walk away and basically nothing happens afterwards. So it strikes me that this particular group here does have ways of dealing with it. One of them is that the conveners, sitting right in front of me, run, I don't want to call them entities, institutes, whatever they are, they're called something, that actually have a charter to do the next steps, both the CI, right, and the institute that you run. Right? So I think we have two people in front of us that can speak to that, and not us. Okay. So I'll point that out. However, we can make some suggestions. One of them I made earlier, which had to do with just, I thought this workshop was really fun. It was fun to hear all these different things. And it's great. I love to argue. It's always fun. Having a venue where you do this regularly is a great thing. And that actually doesn't cost very much. That's a fairly low financially, the financial costs are very low. The time commitment issue is bigger because you have to make time. You have to find, when can you get people together? And we're all very busy people, so that's always an issue. There is one theme that I heard here has to do with this issue of data sharing, that is just knowing who has what data. But I would also say problem sharing. Who is working on what problems and other commonalities, and who's doing what. And then the third one has to do with methodology. One thing that I think Mike and I both noticed is the term machine learning only came up during our session just now. The rest of the talks didn't mention those words. That was noticeable.
And this is the first meeting I've been at in about 3 months where nobody said the words deep learning.
Yes, exactly, right.
Oh, did you say?
Yeah,
I'm
yeah,
sorry.
you did say deep
Okay.
learning. It's true.
I must have missed it with the accent.
But not machine learning.
Only in the sense that I think I said I'm not going to use that buzzword.
Oh, okay. I think you're right. I do remember
Yes,
that.
yes. Right. And so there, in that area, I think what's interesting is that on this campus, there are lots of people that analyze big data. They're rather different than the ones that you deal with, but are certainly deeply invested in methods that speak directly to the kinds of things you want to do. For example, one of the things that some of us in the physical science, certainly in physics, are very interested in is the general issue of what we would call dimensional reduction, meaning you have a data set that sits in an extremely high dimensional space, and what you're looking for are relationships which may not be as easily recovered as the beautiful example that we saw of a hyperplane that cuts because it is a plane, right? But sometimes these data sets are separated by manifolds that are low dimensional but don't look like planes. There's some wrinkled structure. God knows what it looks like. And to discover those manifolds is hugely interesting. So, and there are people that work on this sort of thing here, including the Department of Statistics. So I would say there is a lot of benefits that you could get by basically just hosting a place where these things are discussed and bring people outside of the biological sciences.
I think it's a super interesting question, and I originally talked with Eric as provost about this. He was just becoming vice president for research, and in my long history at the university, the vice president for research, which I think you've been at some point in your career, Bob, assumed responsibility for interdisciplinary innovation in the University of Chicago. Where does it happen? Who promotes this?
Right.
And Eric's taking it on. Kali has spoken about her work, or her prospective work in this area. So I think in addition to your, would you agree, in addition to your idea that we do in fact have institutional institutions to work on it, and would you agree that the vice president for research is one of them?
Absolutely. That's why Kylie is here.
Yeah. The other thing I'll just add to that list of things that Bob gave is training. So I hadn't heard much discussion about, how we're training researchers to, use these tools and do these types of analyses. And there should probably be an opportunity to do something there that's shared as well.
It seems to me that we have meetings like this, the CI host them, and Chas host them, and we I think we do reasonably well, given the University of Chicago's culture at creating these individual point-to-point connections, which often are the most important and valuable. We're not so good at creating institutional structures that support them. So we have the university, the BSD has its Center for Research Informatics, the rest of the university uses the Research Computing Center, the CI tries to bridge the two, but doesn't always succeed. And I think those sort of institutional barriers perhaps do hinder some sorts of collaboration. I think Sam pointed to the fact that he has people there who are a resource, but I bet that the dean of the BSD wouldn't be so happy if they started working to help people in astrophysics or in the social sciences divisions, and so on and so forth. So I don't know how there may be some institutional things we could do to improve the situation.
I have one other comment that has to do with methodologies. So there was a phrase that was brought up late on the day about agent-based modeling. And I'm not going to, so I'll let Mike opine on this separately. But I can tell you that bringing that topic up is very tricky. So let me just tell you a little bit about that. In the physical and social sciences, agent-based modeling can be viewed very negatively, not because of the field itself, but because of misuse or inappropriate use. Modeling of that sort, to have credibility, needs an enormous amount of work on validation, validating the agents and the model that you ultimately build. And those steps are often missing. And it goes to the heart of modeling. I mean, Mike correctly said, modeling, what do you mean by modeling? So this is an example of where modeling can have the following horrible attribute, which is the idea that you've built something, you push a button, out comes a result, and you believe it. That is hugely consequential in terms of causing problems. And you should be very, very skeptical of anybody who says that you can do that.
Any final comments? Albert, take it to the hour.
I appreciate your comment about agent-based modeling. The NIH is highly interested in agent-based modeling, and I believe our colleagues at Argonne who are agent-based modelers are, hopefully they're doing best practices, but it is just thinking long-term in terms of funding and, big questions about, that link, the biology of disease to population health, systems of care. That's why this is a very attractive technique. And anyways, I appreciate your caution about it. And thank you.
I don't want to leave Bob hanging out to dry here. I had the same kind of gut reaction when the term came up. So I think it depends, where you're using it.
I mean, I do as well, but at the same time, it's all very well for a scientist to say we should not make any definitive statements, but which is sort of what you were saying, wasn't it?
No. I'm saying that without a clear understanding of what exactly is involved to make that kind of modeling believable, you should be very, very cautious. That's right. That's right.
With that, let me thank all of you in the room for a really great day and for our panel for a great summary. And it's time for the recess.
There you go.
Carry on there. Thank you very much, all of you.